WAGMC is the West African Genetic Medicine Center. It's a World Bank funded center that is really primarily to develop postgraduate programs in human genetics. And one of the missions of WAGMC is to do medical outreach and to promote the idea of genetic health screening, not only in Ghana, but in the West Africa region. The Medical Caravan was really an idea, I believe, originally of the Okyenhene. As he was planning to tour his kingdom for the 20th anniversary, he thought it would be good to provide health care to the citizens of Okyenhene. And so then the idea of a medical subcommittee came up, and I was approached to chair that subcommittee. And then I worked with others who have expertise in the area to develop the concept of a caravan. So the idea then being that as the Okyenhene tours different towns, the caravan will follow and provide services to citizens of that town. And I have to commend my team. We put together a team of about 50 healthcare professionals with a wide scope of expertise: audiologists, pediatricians, hematologists, speech and language pathologists, biomedical scientists, nurses, teaching assistants, research scientists. It's a really huge, diversified team. And I guess the secret to the team is the commitment that each team member had and buying into the vision of the caravan as a whole.
At my station, we see adults after they've been registered. And we first of all take their blood pressure and then take their fasting blood sugar. After that, they get to see a doctor, and there's some interaction with the doctor, and based on that interaction and questions and answers, we give the appropriate tests. Now, some of these tests that we offer to adults include a full blood count that's going to tell us the hemoglobin level, the number of white cells, and also platelets. We also let all the women go and do breast screening, and we also let the men who are 40 years and above do PSA to screen for prostate disease.
Sickle cell in Ghana, for example, is a very big issue, public health impact that it has on the community. We believe that about 15,000 babies are born with sickle cell in Ghana every year. We don't actually test most of these babies. In this event, we are using something called a rapid test for sickle cell screening. Because usually when people are screened, it takes a long time. They take a blood test, and then it has to go to a laboratory, and then it takes a few days to get the results back. By using this particular rapid test, we are able to, give people the results immediately. So if they are found to be, let's say, a carrier of sickle cell disease, we can give them the counseling immediately. And then also, if they are found to have sickle cell disease, then they can be referred to an appropriate specialist clinic quite quickly.
So we are the breast people. So we are two teams. The first team is made up of 2 midwives. So when you come in, we register you, get all your documentation, and then you enter the room for the midwives. Over there, they do something called clinical breast examination, CBE, where you raise your hands this way, and then they use the 4 fingers to look out for lumps. They go like a mosquito coil throughout the whole breast. If your breast is large, they can divide it into 4 quadrants and then go for each quadrant. When they finish, then they bring it to our section. We have a new instrument called the breast light. So we put the breast light underneath your breast. So in a dark room, we put a breast light underneath your breast, and your breast illuminates. The light is designed to detect blood. So for every breast, you will see the normal blood vessels. And anytime it detests blood, it comes out as black in a red background. So the detection of the blood vessels show the machine is working all right. So if you have any suspicious lump, we will see a black spot in the breast. Once you see the black spot, then we say we've seen something suspicious. So we now have to refer you to the hospital.
The National Blood Service are here for donor education, with education of the public, because we believe that there should be a whole mindset change, so that people do not think about blood donations for relatives and only when somebody is sick. So we're doing education of the general public, telling them about how they can donate blood, what they need to know so that they donate blood. Especially, we have the drone site, the first drone site in the eastern region at Omenako. And so we partnered with Zipline so that we do this education. So after the education, we'll be coming over to collect blood so that we can process the blood and send it to the Omenako site so that it can go to hospitals within the catchment area. And most of the hospitals are within the eastern region. So that's why we're excited to be here. And there have been a lot of people showing interest, and they're seeing that there's a need to donate blood, not only when somebody's sick.
When they come, we'll first of all listen to the problem that they have come with, if they have any, and then we'll examine them. So examination will look out for anemia, whether there's jaundice, check the heart, check the tummy or the abdomen to see if there are any problems. And if there are any other obvious problems, we'll look at them and try and solve whatever problem it is. Aside that, we also will request that they have medications. If they have conditions that indicate that we should give them medications, we'll prescribe and supply them with the medications before they go.
The test we normally do here is a full blood count. We check the person's HB, the BBC count and platelets to see if he has a low HB, if he has indication of infection and others. We also do rapid test for malaria screening. What we normally take to Accra is the prostate screen. When you finish running the test, we seal and then give the report back to see the requesting medical officer.
For everybody, we do what we call an otoscopy. In other words, taking a look in their ear. Okay? So after the otoscopy, if we find out that the ear is impacted with wax, we ask the person to go to have his or her ears cleaned. If the ears are okay, there are a couple of things we do. For adults, we do a screening. Basically, you wear headphones, you hear sounds, you raise your hand when you hear them. If it's normal, that's it. If we detect that there's a problem, we advise that you seek proper audiological assessment. For children, because they can't raise their hands when they hear their tone, there's a physiological test that we do, and it is done automatically. We're able to determine whether they hear the sounds or not by the kind of procedures that we do. The bottom line is that when we detect a problem, we have to ask them to have an in-depth audiological assessment.
So for HIV, you go through a pre-test counseling. You normally will come with a request. Go through a pre-test counseling, go for the test, and then come back with the results for a post-test counseling. So the pre-test counseling will give you information about HIV and other STIs and how you can get it, how you can prevent yourself from getting it. Then after the test, you would come back and we'll talk about your results, whether it's positive or it's negative. If it's negative, what it means, if positive, what it means, and then we'll discuss with you how to refer you to a facility. Normally we prefer a facility of your choice, unless we have any of the nurses working with us who works in a particular facility who would want to take on that case, because you don't want to lose them to follow up. You want to make sure that they do get their medication, because if we are working towards the 1990 strategy. So the 1990 strategy is saying that by the year 2020, 90% of people who are positive will know their status. 90% of those who know their status will be on medication, and 90% of those people who are on medication will get to suppression level.
We've encountered people who clearly need health education, which I believe is the first and foremost important function of the caravan, is to educate people about their health care. We've also provided medical services that clearly are needed in almost all the places we've gone to. We've had lots of people showing up, and these people showing up in clear need of the services that we have provided. So with respect to providing health education and telling people about the importance of knowing their disease state, whether it's sickle-cell disease, breast cancer, prostate cancer, or HIV state. In addition to informing people about the importance of doing that, we've also been able to provide actual services, and in some instances been able to give people medication all for free to treat their various ailments. As of the close of the caravan, I believe we've screened over 2,000 citizens of the Akyem Abuakwa traditional area. So the simple goal of providing healthcare to a large patient population was achieved.
Medical team no Eliona, maybe anyone will be on. Yes, all will be on by say, breast, prostate cancer, HIV, any hepatitis, blood pressure, diabetes, anemia, sickle-cell, overhearing and speech problems, pediatric sickness, and registration of NHI's cards, any insurance. By the end of the toy, all the over 2,500. Emma medical team, Dr. Four, Emma member nurse for lab for Osagyefuo Ofori 50, if you account 65. And you don't have some over here, I watch him. You know me in Islam here.